Welcome to our Carers panel as part of National Carers Week, Caring in 2020. It's fantastic to have everybody here. My name's Elena Katrakis. I'm the CEO of Carers New South Wales, and I'd like to start off our panel today by just acknowledging the traditional custodians of the land on which we meet today. We're bringing this to you from the land of the Gorigal people of the Eora Nation here in North Sydney. And I'd like to acknowledge the traditional custodians of the land, of all lands where we're meeting today, where everybody might be from across the country. So thank you very much. So hoping that everybody can hear. A couple of false starts there and a bit of jittering around, but it now gives me great pleasure to introduce our facilitator and chair of our panel today, the fabulous Georgie Gardner. Georgie is one of the country's best known and most popular television news presenters, and she's currently anchoring 6 p.m. news on a Friday and Saturday night. She is amazing. She's done some carer work with us previously. Georgie's hosted and has been a newsreader for Nine's breakfast show Today for 9 years, and I think everyone knows her very, very well. She is passionate about charities, particularly those relating to young people, and she's an ambassador for Red Kite, School for Life, Raise Youth Mentoring and Dress for Success. Georgie's a mother to Bronte and Angus, and along with her husband Tim, lives in Sydney. And it's a great pleasure to hand over to Georgie to introduce our fabulous carer panel members and start the conversation this morning. Thanks, Georgie.
Thank you, Elena. Thank you for that lovely introduction. Can I start though by saying I'm far from amazing. The people hopefully who are listening today and who are joining us on the panel are amazing. The great privilege of having a platform as a journalist on national television is that I get to talk about things that I'm really passionate about, and something that I think doesn't get nearly enough recognition is the extraordinary and amazing work that carers right around this country are doing. You are the unsung heroes, and we thank you for all that you do in terms of the contribution you make. So it's a great pleasure now to introduce 4 very special carers, all in, I guess, similar situations, but facing different circumstances and different challenges. And today's webinar is an opportunity to gain greater insight through your individual lived experiences and to explore strategies implemented by you for managing your various responsibilities and duties. So I'm going to start by asking you all to introduce yourself and giving us a brief idea and understanding of your particular situation. Starting with you, Simon.
Thanks, Georgie. Good morning, everyone. It's excellent to be with you this morning. I care for my son, Joshua, and he's 25, and at the moment he's in hospital in an acute ward. I also work with Northern Sydney Local Health District as a carer peer worker, and I'm very passionate about trying to influence clinicians. And I also do a lot of sort of voluntary work with Carers New South Wales. Good morning to everyone.
Thank you, Simon. Amanda Sharma.
Thank you, Georgie. Good morning, everyone. I've been caring since I was 8 years old. I cared for my grandmother who had chronic illnesses. I became a primary carer for my mother who has a mental health condition since the age of 13 when my father passed away. It's only my mum and I. My doctor was very supportive, but I kept what I was doing hidden as I feared child protection services. I didn't realise I was a carer until I turned 18, and I reached out to Carers New South Wales, and they helped me, and they're still helping me today. I did my business degree and I struggled to gain employment. Many employers focused on how inexperienced I was, but I was given opportunity to volunteer in the research team at Carers New South Wales. They made me feel valued. Since moving from the city, I now attend carer support groups. I'm very passionate about young carers and the unique challenges they face. I'm on the New South Wales Carers Advisory Council, and being Australian born, I'm lucky to live in New South Wales. And unlike 15 years ago, I'm so happy to see there's even more help for carers out there.
Thank you, Amanda. Thank you. Janice.
Thank you for the opportunity to be here, and good morning, everyone. I care for my son, Stephen, who has late-stage multiple sclerosis and lives in an aged care facility, as I haven't been able to find any other option that is safe enough for him, as he has lots of disability and needs help with every aspect of daily living now, can't do anything unaided. As well as that, I worked for about 30 years in mental health, and I advocated for carers very strongly there. I worked there as a family therapist and did a lot of training around New South Wales to help other people in mental health acknowledge and support carers and families of people with mental illness. So I've had to listen to my own advice a lot lately. Thank you.
Thank you, Janice. And Moira.
Hi all, my name's Moira. I've been caring for my mum at home for 4 years. She had a stroke, which meant she couldn't do anything. She can still have the use of her right hand. She can't stand on her own or sit up or even change a channel on the television. So there's equipment involved, and it's 24/7. I do have some help from the care package providers where I get respite during the week. It's been a tough year, that's for sure, and I'm sure you all know that. Anyway, that's my situation.
Thank you, Moira. Well, that's probably a good segue to talk about this year. We know due to the COVID pandemic, it has been incredibly challenging for everyone, but I imagine for all of you in your particular situations, it has been tenfold. Give us, if you could, Simon, a little bit of an understanding of how the pandemic has impacted you and your son particularly.
Thanks, Georgie. From my perspective, I've really found I've felt quite isolated. Before the pandemic, I used to really love getting out and having coffees with carers. I also have family down in Melbourne, and I used to use that as a bit of sort of carers respite before I had this thing called sort of carer breakdown, or you get overwhelmed with everything. But since all the borders have been locked down, I can't go and visit my parents, and my daughter's down there, so I haven't seen her since February, which I don't want to get into the sort of politics of border opening and that sort of thing, but I think the borders should be opened. And it's been really tough with my son. He's got an acute mental health illness, and we tried for as long as possible to keep him out of hospital, but about 2.5 weeks ago, he was admitted to hospital in Northern Sydney, and we've only seen him once. It's pretty bad, the hospital situation at the moment with COVID. You're only allowed to have one visitor and only allowed to visit once a day, and you have to wear the face mask and go through all this COVID testing. The isolation has been a really big thing for me.
Yeah, understandably so. Amanda, you can offer a unique perspective of what it feels like to be a young carer living through this pandemic, and the implications, I guess, for you on the work front and the study front, just the day-to-day. Tell us how 2020 has been for you.
I think COVID-19 has been difficult for many carers, especially young carers. For myself, I did face some challenges. I was in part-time work, and then I was let go in March, and then I was reinstated, and then I was let go, and I'm back as a casual. I know the Premier encouraged a lot of businesses to work from home, but in my case, I wasn't allowed to work from home. Many of the services, my mum's seniors hall and the Women's Health Centre was temporarily closed, so I had increased care responsibilities and less respite. For the first 3 weeks, my mum's mental health really deteriorated, as she was scared of leaving her home because she's scared of she was going to catch COVID-19. Even I was worried to go to places because I didn't want to pass anything on to mum. So thankfully, the Women's Health Centre started doing Zoom classes, and I'm very grateful to them because mum didn't miss out on her classes and she still kept in touch with her friends. Another challenge was getting groceries. As everyone knows, it was very hard to get toilet paper this year. Woolies and Coles did have a dedicated day for elderly and carers. However, when I and my other carer friends went to to the supermarkets, we were turned away because we didn't bring our loved ones with us. I informed Carers New South Wales and the Carers Advisory Council, and they really took swift action by writing to them. And later on, supermarkets and the public realised that there are many different types of carers out there, not just those who look after people with a physical disability.
Yeah. Well, as you mentioned, it's added a whole layer of complexity to your situation this year. Janice, you mentioned having a 47-year-old son in an aged care facility, and of course, aged care facilities have been absolute hotspots for COVID-19. How have you navigated through this year?
I guess the greatest challenge for me has been the lack of contact I've been able to have with my son. And I do appreciate that aged care facilities were trying to keep their residents safe, and largely in New South Wales they've managed to do that. But there was almost a period of 4 months when I wasn't allowed to visit at all during the beginning of the year. We were allowed to, at first there was not even access to video conferencing or anything, so that was very anxiety provoking, not knowing how he was and not being able to judge face to face how he was going. And since then there have been 2 more periods of lockdown. I think people in aged care facilities have been subject to more severe lockdown than even the poor people in Melbourne, so through the year. So that's been difficult for me as a carer, and certainly very difficult for him as well. And he's got quite depressed when the facility's been locked down, even when there was video conferencing allowed. And sometimes his NDIS carers have been allowed to go and sometimes they haven't. And when he's not been allowed any visitors, he gets very depressed and I get very anxious. So that's the biggest challenge that it's brought about for me. Looking after, for myself personally, I guess I've managed to negotiate, still being able to do that through COVID. It's more just our relationship.
Yeah, understandably so. Moira, of course, this has been a year of horrific bushfires. We saw out last year and entered into this year with just horrific scenes, particularly on the south coast of New South Wales, where you and your 94-year-old mother reside. And my understanding is you were forced to evacuate. Give us a little bit of an understanding of what you went through.
Yeah, that's right. We knew it was a bad season. We live in a very bushy, treed area, so we've always been quite conscious of when the season is dry and when the conditions are looking bad. So we knew it was bad. I did a fire plan to the best of my ability, and I followed it. We got a phone call at 6 a.m. one morning with a very strident siren in the background saying, "You must evacuate now." And I had a lot of things ready, but it's still, I have to, transfer mum into several things to get her. And I'd never got her in the car before. We don't have a wheelchair accessible vehicle. I had my neighbours on hand and they helped. Some had already gone. So it was a hugely anxious time and very, very scary. My plan was to go to the hospital because there was nowhere else I could go. I couldn't even leave early, as the fire plan says. because where would I go that has the equipment to be able to look after mum? So I figured, right, we're going to have to just basically do the bolt at the last minute when we know it's at that stage, and then I'll go to the hospital and see if they can help.
And were they able to?
They sent us to the evacuation centre, which was a basketball stadium. It was 36 degrees with lots and lots of people in it. And my mum's in a borrowed wheelchair, and there was very little help to even get her to the toilet without the equipment that I need. But someone saw us and made a phone call to the local aged care facility, who thankfully took us in, and we ended up staying there for 8 days.
Wow. And are you back in your home now? And how are you and your mum faring?
Thankfully, our home was not burned, although the next little village along was totally razed, and it could have been us. We're in the same sort of situation. We were just really lucky. Yes, we're home. Of course, COVID has come along and it's made things a bit more difficult again, but we feel like we're getting back on an even keel now, although it's coming up to summer again. So all that anxiety is washing back up, and you just have to be on the ball and know what you're going to do. And I think I have some better ideas now, because I've now evacuated twice.
Well, let's hope you don't have to again. My goodness me, I can't begin to imagine how challenging that must have been. So this year, clearly for all of you, has had that additional layer of complexity and anxiety, whether it be through the bushfires or the pandemic. How would you say, Amanda, these added challenges have affected your own health and well-being? And what have you done to care for yourself?
So this year, my mum and my health and well-being was affected. At the beginning of the year, I had a plan that my mum and I were going to join a hobby class, and that went down the drain. But my mum's health has improved. When her women's health centre went via Zoom, that really, really was a lifesaver for my mum and for myself. And also, we always go to the Anzac Day memorial services, and this year we were able to do this. We were able to pay our respects through our neighbourhood driveway. So we just had to adapt to new change, adapt to Zoom, and adapt to online. And for me, I access the Carer Gateway's Wellbeing counselling service, and they really supported me in that sense. So it was great to talk to a counsellor via online and debrief. So that thinking positive and just saying that I can do that next year kept me going.
Oh, that's wonderful to know, Amanda. Simon, you mentioned how you very much felt the effects of the border closures. I'm wondering though, was there anything that you found helpful in managing your way through those particularly difficult months?
Yeah, well, thanks, Georgie. I was going to add about the elderly down in Melbourne. I don't think there's enough mental health support being provided for them. My parents are in their 80s, and I love them, but my dad's starting to give me the shits because he's calling me every morning. He's really lonely. He's calling me every morning and like, have you seen Dan Andrews' press conference? And all I would hear was, 3 people in their 80s die today, and this sort of thing. But yeah, to get back to your question, what I say when carers ask me what do you do to look after yourself, I say the 3 most important things for me as a carer are self-care, self-care, and self-care. So
how do you do that?
Yeah, you have to do it. And I go for walks. Support group. I find support groups are really good for me. The problem with the pandemic is a lot of the support groups have closed down, so they're all online. And like when you've got someone in the other room that's sort of got a mental health condition, you can't really say, my son's giving me the shits because he'll hear it all. So there's only one support group that's reopened recently, and that's down in Northern Beaches, which I love going to. So, I sort of miss having coffee with carers. I had a coffee with a carer this morning. I like the football. At least the footy's kept on going. So that really helps me. But to get through it, I've just focused on work because I work with New South Wales Health. And since the end of February, March, everything's been online with Skype and Zoom, and I'm getting a bit Skyped and Zoomed out, but at least there's some sort of contact, and it's great to be able to network with carers and represent carers' issues, because I'm on a number of committees to represent carers' issues, and now we're trying to actually educate the clinicians, the doctors and the nurses about what it's like for families, because they represent consumers like the patients very well, but they often forget what it's like for families. And we've been, since my son's been in hospital like 2.5, 3 weeks ago, and we've only seen him once, and we've been absolutely traumatised by the whole thing. And, my wife was told he never wants to speak to you again and this sort of thing. So that can be really traumatising, and we had to, I won't go into all the details, but he was very unwell and sort of psychotic. So we had to call the ambulance, and then you've got to go through the ambulance, and they go and ask you, is he COVID positive? Can you put on a face mask and all this sort of thing? So I've tried to get out there, exercise, take care of myself, but we managed to keep it going. But, luckily now in New South Wales, the cases are a bit lower. So we're happy that he's getting really good treatment.
So, the bottom line is you're all living with a certain amount of anxiety, whether it's low-level anxiety or at times I imagine it's high-level anxiety. Janice, what strategies have you put in place, or where have you turned to provide yourself with that self-care that we've just heard Simon talk about?
For me, I think maintaining connections with other people is the key. So I've done that in various ways. At first, it was mainly online, I have to say, I even did things like video. We had a movie night with our family online where we all watched the same movie together, even though we couldn't visit each other. And I walked every day with my friends using appropriate social distancing so that I was maintaining my exercise as well. My NDIS support coordinator has been a big help to me through this time. She's provided me with practical support as well as emotional support as well. So that's been really helpful to me as well. But I have had to work quite hard at keeping up with my friends and my exercise and eating well, all those things that I used to encourage other carers to do. I've tried very hard to do those for myself as well. So that's been helpful.
Moira, can you relate to that in terms of really having to set aside time and put in that effort, even when you perhaps just want to, curl up in the fetal position on your bed or on the couch, but to really make an effort to get out, to talk, to have that contact with other people who
I don't have many hours a week where I can go out. And a lot of the time that's to do shopping or appointments or whatever. So that's what I do, and I do enjoy it. The local community, the shop owners, whoever you meet, become a real network of friends and helpers in a way, because they understand what you're going through, because they've gone through it as well, but they know you're a carer. So they offer that support, and of course family, just keeping in contact with them.
What could be done differently to better support carers, particularly in these times of crisis, do you think, Moira?
Right. I kind of find that, well, I've kind of been working on the fire plan thing, and I think because that was the biggest thing for me this year, and I thought we really need a carer's fire plan, like specifically with far more detail about how you can prepare somewhat for a disaster like that, and that would help. And it needs to be kind of run at a like some policy level, maybe, to be able to get to all the carers that maybe don't have access to that, and maybe can't even get on the internet very well because they're older, or anyway, that's just a thought I had.
Yeah, well, it makes a whole lot of sense. What about you, Simon? Where do you see areas that that could be improved upon in terms of providing better support and understanding of your situation?
I think the one area that really needs a lot of focus is sort of carers caring for someone with mental health conditions. Just to explain why, like my son and a lot of other sort of care recipients, they've had social isolation for many years. And like my son said to me, you know, why are all these people complaining about COVID lockdown and social isolation? He said, I've had that for years. So they're in their sort of happy little, what do you call it, little reality. But for carers of mental health conditions, it's really tough because you're isolated, you're cut off, and there's like I had my son when he was psychotic and he's screaming at me in a small little apartment, which is really tough. So I think the sort of support services around there, sort of consumers, or what they say consumers of patients with existing mental health conditions, there's a lot of focus on them, but not the families and the people around that. And it's really difficult. And I think the isolation, where a lot of us are getting sort of used to this COVID lockdown, and there's some benefits of it. You know, you have great times with your family and everything, but you know, what's going to happen after this? And people are going to probably stay, even if we have a vaccine next year, they're probably going to stay in their houses and scared to come out. And so I think we need to sort of re-engage with the community. But it's great to have these sort of events, but it's not face-to-face, if you know what I mean. It doesn't have the, and what we've found at New South Wales Health is, like I'm working on a strategic plan at the moment for Northern Sydney, and we got everything to a certain stage, but then we had to meet face-to-face in a huge auditorium to do a brainstorming, because you can't, this works, but you can't really brainstorm on a Zoom Skype meeting.
No, of course, it has its limitations. And then no doubt you can talk to what Simon was just relaying, given your mother's mental health situation. Where do you see areas of particular need from where you sit?
Yeah, there needs to be more awareness that there are many different types of carers. I think in public eyes, they think people with a physical disability, they're the only carers, but there's so many. I'm hoping businesses can be more supportive to working carers, especially young carers like myself, giving them flexibility to work from home. I'm encouraging primary carers like myself, please keep in touch with your neighbours and your friends. When I went to my sad state, I kind of shut off from the world, and that's not good. It's really important to keep in touch with your friends and your neighbours, and access those services out there. Carer Gateway was released in April, and I encourage, all carers out there to access this. There's peer support groups online. They're going to have face-to-face soon. You can ring and talk to a counsellor. Like I've rang and spoken 3 times, and it really, really helps. And access the services, they're there, and don't shut off, and be strong. We are very resilient people. Do your self-care, listen to music, take a walk, have tea in your backyard, and we do it for love. So I'm proud to be a carer for my mum, and I love doing it, and it is rewarding.
Amanda, can I just ask how old you are, if you don't mind?
I look really young, but I am 28 years old. So I've been doing it for a long time.
You are quite remarkable and inspirational. I'm just so blown away with your attitude and your strategies that you're putting in place. Your mum is one very lucky woman to have you. You'll all be interested to know that we have some fantastic live questions coming through, and I'm going to put some of them to you. This first one is for you, Janice. And our audience member says, Janice, you mentioned that your son's been quite isolated in his nursing home and that his NDIS supports could sometimes not visit to provide that support. Has this impacted on your son's physical and mental health, and what impact has this had on you?
So the answer to that is yes, it has. It's impacted to such an extent that they've needed to put him on a food and fluid chart because people noticed he was losing weight, and I think he was quite depressed. Some of that because he's eating food in an aged care facility, which he finds a bit bland and boring, but some of it I think he just couldn't be bothered anymore, and he seemed quite lethargic. So it's affected him, and because I know it's affecting him, it's made me quite anxious at times, and I've had trouble sleeping at times, especially in the beginning. Things are somewhat better now, and I was delighted with the recommendations of the Royal Commission into Aged Care, which recommended that nursing homes apply for funding so that they have more resources to screen families and carers so they can go there more often. It does seem to be up to the individual facility whether they apply for that or use that or not, which makes me feel I now need to go and advocate for that with my facility. But it is nonetheless a really good thing to recognise carers in that way.
Absolutely. This is a general question. I might start with you on this one, Simon. If you could choose any support to receive as a carer and it was free and easy to access, what support would you choose?
I think from my perspective, I really find support groups really helpful. Just to explain why is you go to see all these counsellors and they don't really get it. It's only people that have been through it themselves. So what I'm really missing is a male carer's mental health support group. There's no male carer's mental health support. So all the support groups I go to, and in general, there's a lot of women carers. So there's not as men are sort of thought of, there's a bit of stigma in the society around male carers, and it's sort of expected you're meant to go and work and this sort of thing. And I had some career issues in the past, but I really love hearing what other carers have been doing, and the support groups exist, but a lot of them are virtual at the moment, and that really helps me. And one other area I think would be really good is carer respite. There's not enough respite for carers, and as I was saying, during COVID, before COVID, I used to escape down to Melbourne, but now if I escape down to Melbourne, I'll catch COVID, or I've got to come back for 2 weeks isolation, and then I can't work and I can't care. And so it's like, so they're two areas I can think off the top of my head.
It's really interesting you mentioned those stigmas about being a male carer, because I often hear that from fathers of young children who choose to be the stay-at-home parent, and I think it's just crazy that we still have these sort of notions that a father can't be the full-time parent or can't be a full-time carer. What are your thoughts, Moira, on being able to access I'll address that question again. If you could choose any support to receive as a carer and it was free and easy to access, what support would you choose?
Okay, I do get good support through the care package. Oops.
We've got you.
I get very good support through the care package, and it's 100% necessary. For the first year and a half, I had 2.5 hours a week where I could leave the house. My brother comes down every third weekend from a couple of hours away to give me a bit of a break. I'm still here, but I can then actually, you know, go for a walk or whatever. So that's definitely a major one. I haven't tried a support group, so thanks for that, Simon. I might actually try one. And Amanda?
Yeah, well, it sounds like there's a lot of value to be had from just being able to share your experiences and know that it's a path you're not walking alone, Amanda.
If I could just jump in there for a moment, I also have found support groups extremely beneficial in that I have attended an MS support group for a long time, travelled quite a long way to get there with my son, and I've continued to do it online and to meet face-to-face with a couple of carers who also go sometimes. So I would really echo Simon. They really understand the issues that you face without you having to explain yourself all the time. And you can talk about absolutely anything. It's wonderful.
Well, it's a bit like Mother's Group with a brand new baby, where you're just navigating this, you know, your world's been turned upside down, you're sleep deprived, you're confused. And to be able to just sit with other mothers who are walking the same path and having very similar experiences can be incredibly helpful. Amanda,
Georgie, what I was going to add,
sorry,
I think often carers, until you are a carer, it's whenever you meet someone, you have to go and you have to tell your whole story and introduce, and that can be traumatized. Like I mentioned, you know, the police and the ambos and this sort of, that can be traumatizing for me. But when you meet a carer, they get it straight away. Yeah. Straight away, they've got what we say in New South Wales Health, they've got the lived experience.
Yes.
So because they've got the lived experience, it means they really get it. And you spend time, you don't waste time. Like if you go to a psychologist, you can waste 25 minutes when you're paying $300 to basically explain all the history. And then at the end they'll say, oh, so he was traumatized when he was young or something, or you know, he's got mental health conditions because he was abused as a child. And he's had the happiest childhood that he could imagine. But sometimes mental health conditions just happen for no particular reason. So when you meet a carer, they get it straight away. You go straight to giving great advice and support. But there's not enough emphasis on that. Before NDIS, there used to be a lot more support for carers, but since NDIS, now it's all through the care recipient. So what happens is it's quite difficult for carers. They've introduced this carer gateway, like Amanda was talking about, but that is online. So it works well under COVID, but yeah.
So Amanda, what Janice, Simon and Moira have all touched on is how important it is to be speaking to people who speak the same language, to being amongst people who have that similar lived experience. Just explain to us as a young carer how that works for you.
Yes, so my mum's not on the NDIS because she chooses not to be. I attend a face-to-face carer support group. Even though they're beautiful people, they've got their carers who are caring for people with mental health condition, but they're all above 40. I still mesh with them because we still have the same, we're going through the same thing. I'm hoping to meet young carers out there in the community. I know they're out there, but I know they're working part-time jobs. Some are just based at home. So it's really important to go to the carer support groups because you can debrief and you can just relax and they get you. Another thing is the online peer support groups are really good as well. I was able to meet a carer in Penrith, and I live in southwest Sydney, and it was really great because, again, we go through the same thing. So I'm just hoping young carers, if you're listening, please access Carer Gateway, go to carer support groups, and yeah, I hope I can meet you one day in the future, but I know there are a lot of them out there, but it's very vital to access services out there.
It's very evident that all of you in your unique ways are facing similar but also different challenges. I know also that caring can bring great joy, and I thought it might be nice just to end on a positive note with you perhaps telling us of the good things that have come from it and continue to come from it. And maybe you might like to start that off for us, Amanda, with the amazing positive attitude that you have.
We have to stay positive, I suppose. So definitely keep up with your self-care, access the services out there. I encourage to please access Carer Gateway. Also download the Australian government's COVID app and be positive. And if you treat yourself correctly, then you can help out your loved one. So it's important to help yourself first before you can help your loved one.
And it sounds like you have a very close relationship with your mum, which must be something you treasure greatly.
Definitely. It's just my mum and I. So I love caring for her, and it's a bit of a challenge at times, but we do it for love.
Of course. Simon, what would you like to say on that note?
Well, I think there's some real positives about the COVID time. I think we for the first time we're spending a lot of time with our families, sometimes in enforced isolation, and it's bad for stress and everything. But I a little bit like what Amanda was saying, I find it very inspirational seeing sort of young carers like Amanda, and I know another young carer who's really inspirational, and I've been having coffees with him on and off during COVID, and just meeting people like that, and it's not all bad, and we do it out of love, and that's sort of one of the main messages I wanted to convey. Is it's we're there to share our love with our loved one, and to go through all this stress and everything, you've got to love someone quite a lot, and so I think we're bringing out a lot of love, and the system is really improving. It used to be people they used to be locked up in mental health facilities. So things are really improving. There's still a long way to go, but it's great to be able to engage with all the carers today. And thanks to New South Wales, Carers New South Wales, it's great to organise these type of events, especially during Carers Week.
Yeah, absolutely. And Moira, tell us about the relationship you have with your mum, 94 years old. As you explained, she suffered a pretty serious stroke, but no doubt there's a great bond and connection between you.
Yes, she was quite physically impaired, but her wonderful mind is still there. And I was married quite young and had kids quite young and moved away. So lived away from my mum for much of my life, and it's a real privilege to be able to spend this time with her, and she's still teaching me how to do cryptic crosswords, and I've always wanted to care for my parents no matter what. It's something I've wanted to do, and of course I do it for love. I love Mum, and she's great value, and it's wonderful to have her around and to have this time with her that's a very one-on-one time.
That's beautiful. And Janice, finally for you, how do you derive joy from the time you get to spend with your son, albeit him being now in a nursing home?
I guess I would echo what everyone else has said. I have a deeper relationship and a more meaningful relationship with him than I would have had if he didn't have that disability in lots of ways, because he would have been off living his own life and having children. And while there's loss in the fact that he's not doing that, we do lots of things together and we are very close. I go in, we do French lessons together on Duolingo, and I go and visit him, and lots of other things that we share, his interest in politics, and, so that's been a real joy, and I've learned a lot from him too. He is so strong and resilient that I have learned, in a way, it makes me pull my socks up sometimes, because I think if he can cope, I can cope. So that's been really useful as well.
And how's your French?
it's getting there. Yeah.
Well, let's hope at some point those borders reopen and you can go and put it to full practice in France. It'd be lovely to take him too. Amanda Sharma, Janice Nair, Simon Johnson and Moira Hoppy, it's been a great delight to speak to you today. Thank you for being so candid. I think what we can conclude from today that being amongst other carers and having that support network in place and feeling valued is just so important. So let's hope that from today's panel, we're a small step closer to achieving that. Thank you so much for your time today. And it's my great pleasure now to cross back to you, Elena.
Thank you, Georgie. Thank you, everybody. I think what a great conversation. I think while we know that 2020 has been extremely challenging and particularly so for carers, I think the issues that you've raised and some of the positive things, particularly around that, you know, peer support, engaging with other people is really, really important. And I think access to services for carers, you know, currently nationally is through the Carer Gateway. There are online services, but there's also face-to-face services, and there's a direct 1-800 number that anybody can phone to access those in-person services as well. So not just online, I think, which is also great. But I think everybody, I think sharing their experiences today has been really valuable, and hopefully all of our people that have joined this has taken, you know, something away that's been really positive. As well as understanding some of the challenges from different perspectives. So I really, really thank you for your time, and also thank you to Georgie for just being brilliant in terms of understanding the issues, bringing out the issues and engaging with everybody so well. Thank you so much. So thank you, everybody. There'll be a link sent to everybody that's joined today. There's some feedback on the session as well. And thanks to all of the staff at Carers New South Wales who helped put this together. So thank you, everybody, and we'll finish it up there, and hope everyone has a great day.